You're welcome to my next class. So just briefly look at what fasting plasma glucose is, FPG. Of course, know that glucose is a type of sugar and it's one of the primary fuel the body uses. It provides cells with the energy they need to do their jobs and stay alive. As such, every single person has glucose flowing in his or her blood. Usually, blood glucose levels are regulated by hormones in the body. Of course, know the hormones, insulin and glucagon. So insulin does its own. When glucose level is high, it brings it down. Glucagon, when glucose level is low, it brings it up. Now, how is the fasting plasma glucose test performed? Of course, we know. Fasting plasma glucose test is a blood test that looks at your blood glucose levels when you have not eaten. So the patient is asked to fast overnight and come the next morning, and blood sample will be collected before noon. Yes, and the fasting sugar level will be estimated. And we have reference ranges, and this reference range depends on the lab that does it. So, for example, fasting plasma glucose can be 70 to 99 milligram per dl. Yes, and is considered within normal range. Also, fasting plasma glucose level of 100 to 125 milligram per dl indicates you may have pre-diabetes, sometimes referred to as impaired fasting glucose, while greater than 126 milligram per dl indicates you may have diabetes. And most of these results is dependent on the lab that did the test. What are the advantages and disadvantages of fasting plasma glucose tests? Okay, so let's go ahead. One advantage of the fasting plasma glucose test is that for many people, it is relatively convenient. The test can typically be done in the healthcare provider's office, where we'll use a point of care testing and we'll do it. Now, the main disadvantage of the fasting plasma glucose test is that a single test cannot confirm a diagnosis. So, if, for example, the test is done and, for example, it is high, you don't just conclude on that. So it has to be done nothing less than 2-3 times at different occasions in order for us to ascertain if the person is having pre-diabetes or having type 1 or type 2 diabetes. Now, what is random or casual plasma glucose test? A plasma glucose test is a measure of how much sugar or glucose you have circulating in your blood. So random or casual simply means that you have your blood drawn at a laboratory at any time, irrespective of food. Yes. So we also have what we call oral glucose tolerance test, OGTT. It's possible for people with diabetes, even those with symptoms, to have a normal fasting plasma glucose test. If you fall into this category, you will again be asked to abstain from food and drink, except water, for 8 hours, and then drink a liquid containing a known amount of glucose, usually 75 grams of glucose. Your blood is drawn before drinking the glucose mixture, and 2 hours later, you'll be asked to refrain from eating until the test is completed. This test is called an OGTT, oral glucose tolerance test, and the fasting plasma glucose normally is less than 100 milligram per dl. Values from 100, in fact, it's less than 100 milligram per dl. Then values from 100 milligram per dl to 126 are diagnostic of pre-diabetes. Then fasting plasma glucose levels equal or above 126 milligram per dl are diagnostic of diabetes. So 2 hours after the glucose drink, your plasma glucose normally is less than 140 milligram per dl values. That's the normal one. Okay, then values from 140 milligram to 199 indicate that you have pre-diabetes. Then you have diabetes if the plasma glucose levels are equal to or greater than 200 milligram per dl. So quickly look at the pancreatic hormones. Of course, we know that the hormones are majorly that concerns glucose are insulin and glucagon. We have types of pancreatic cells. We have the A cells, B cells, the D cells, and the L cells. So we know that the insulin as a hormone, or the hormones for glucose from the pancreas, are from the beta cells of the islets of Langerhans. So under the types of cells, the A cells producing glucagon, 25% of all islet cells. The B cells producing insulin, 60% of all islet cells. The D cells producing somatostatin, 10% of all islet cells. Then the F cells producing pancreatic polypeptide, 5% of all islet cells. So the B cells produce insulin, while the A cells produce your glucagon, the D cells somatostatin, and the F cells pancreatic polypeptide. Okay, so let's go ahead. We have mentioned that islets of Langerhans play a crucial role in carbohydrate metabolism and so in plasma glucose concentration. Now it involves glycolysis, glycogenesis, glycogenolysis, gluconeogenesis. We have said all these in our previous class, and we've talked about the hormone insulin. We've also talked about the hormone glucagon. So we'll be looking at the hormone somatostatin. It's a peptide composed of 14 amino acids produced by pancreatic D cells. I said it just now. Also in the stomach and intestine, especially after meals, it responds to increased amount of glucose and arginine. Okay, reduces HCl production, slows down the digestion process. It suppresses insulin production via paracrine secretion. It's a gastrin antagonist. It inhibits glucagon. It terminates storage and reduces glucogenesis and the overall exocrine action of the pancreas. So we'll quickly look at the pancreatic polypeptide. It consists of 36 amino acids, mainly in the head of the pancreas by the PP cells. Its role is the auto-regulation of endocrine and exocrine function of the pancreas and stimulation of the production of gastric juices. Secretion increases during starvation, exercise, and acute hypoglycemia, while decreases under the influence of somatostatin and after IV administration of glucose. So in our next class, we'll quickly look at the glycosylated hemoglobin and lipids. See you in my next class. Bye.